Good morning, afternoon, evening, even night for some of you. I am Ronan Floch. I am representing the MBC, and I have both the the pleasure and the difficulty to present this webinar today. Lucy from Interburns will close it. She worked a lot to prepare this session. As you see, this session is about hidden cost. Should you speak someone, tell someone that you are taking care of burn patients, they will respond, "Oh, it's terribly painful." But very few know that it's very expensive, both for the health system and for the patients. So you can see the translation if you wish to do it. So you go to the bottom bar of your screen. You will have the CC. You will click on the arrow to the top, and you can start the translation and choose the language you wish. You are not only English, Spanish. You have all what you can wish to hear as a language. So, since we are speaking of the hidden cost, the first presentation by Rojina Shilpakar will be about the actual cost. In a very poor country, since Nepal has the 143rd level in the Human Development Index. Rojina is a surgeon, and she's the deputy medical director of the first, and I think only special burn hospital in Nepal, which is named Sushma Koirala Memorial Hospital. It was founded by Interplast, which is a German organization. And she is a regional South Asia clinical lead for Interburns. And she has been member of the international faculty in India, Tanzania, and United Arab Emirates. Please, Rojina.
Thank you very much, Ronan. So shall I share my slide now?
Yes, please.
So namaste and greetings once again. I'm Rojina to everyone present here. And I would like to thank the steering committee of World Burn Week and the panelists and interburns for giving me this opportunity to speak about the cost of burn care management in Nepal and the lower income countries. We know that this week is so important to mark the burn injuries in the world, because about 11 million people sustain burn injuries and 180,000 people die annually, the majority of whom take place in low and middle income countries like Southeast Asia and Africa. And WHO has estimated tallies of 84,000 people just due to the burn injuries. We can see in this table the disparity and the differences of the incidences of burn. Per 100,000 population in South Asia, in Sub-Saharan Africa, about 160 to 140 people get burned. In Southeast Asia, about 130 per 100,000. In Middle East and North Africa, about 60 to 50 people get burned. And in high-income countries, only about 10 people get burned per 100,000 population. Especially in Southeast Asia, South Asia, Nepal, India, and Bangladesh have higher number of burn cases. The rates are very high in comparison to high-income countries. And it is mainly because of the common cause, which is the low and the poor living setting, in which people are exposed to the open fires while cooking and lighting the fire for warmth. As we can see in this page, South Asian countries, to treat one burn patient, it would cost around $2,000 in average. In sub-Saharan countries, African countries, about $550 in average. In Southeast Asia, countries like Vietnam, Indonesia, and Philippines, the average cost would be $1,000 to $2,000 per patient. In Middle East and North African countries, from $1,500 to $3,000 per patient. And in middle-income countries like Latin America, Brazil, Argentina, and Mexico, it would be between $2,000 to $3,500 per patient. The disparity we can see in high-income countries and low-income countries is huge. But in the case of high-income countries, this high cost is owing to the advanced technology, their specialized burn care, and increased number of various options of high-quality care and high-quality medicine and dressing materials. But in low-income countries, this even if we have high rate, the cost is low because we have very basic burn settings and basic resources to treat burn patients. Some of the cost drivers in burn treatment are surgical procedures, dressings, bed charges, rehabilitation, and medication. These are the main cost drivers. In 2021, a study was conducted with the help of technical and the financial help of interburns in 2 specialized hospitals in Kathmandu, Sushma Koirala Memorial Hospital, where I work, and Kirtipur Hospital. These 2 hospitals were selected because these 2 are the specialized hospitals. And from the studies, it was found out that the average cost of treating burn patient was $2,283, which exceeded the annual per capita income of Nepal. In 2021, it was $1,229, and in 2023, it did increase $1,324, but the treating of one burn patient was still high. Both these hospitals run largely on international donations. And in case of our hospital, it is Interplast Germany Foundation who are providing charity for free and the subsidized treatment of patients. It is still a burden for the donors. We divided the patients into 3 pathways. One group, pathway 1 with superficial burn, and pathway 2 with mixed depth partial thickness burn, and pathway 3 with full thickness burn. So this division was to evaluate and to identify the various cost drivers. To treat, we found out that to treat one patient in pathway 1, $896 were spent. To treat one patient in pathway 2, $1,725 were spent, and to treat one patient in pathway 3, $4,227 were spent. The direct cost that we evaluated, that we identified, was registration, senior doctors and junior doctors' fees, consultations, drug treatment, including antibiotics, IV fluids, pain management, dressing, which was the very basic dressing like Vaseline gauze and sterile gauze bandages, investigations whenever needed, surgeries, it was the average number of the surgeries we considered, and other therapies like blood transfusion, nutrition, rehabilitation, and ventilation. But whenever it deviated from very standard basic care, like for example, in this dressing, collagen was used, the cost would go up high. Whenever there was lack of donor sites, we had to use meat graft in which the materials are expensive than doing the normal mesh graft 1:2 or 1:4. So other hidden costs that we identified for the patients and for institutions were transportation. Most of our patients come from outside Kathmandu, and the cost, their unexpected cost, would add up because of the transportation and fuel. And because of this, there'll be late presentation with complication, increased number of days of admission, procedures, and increased costs. For example, this kid presented late and had to go through a number of procedures which could have been less, and also ended up losing the digits. Another cause of hidden cost increment is lost income. The patients like this who come from far away, they are more concerned with losing their daily wages than their treatment, because once they come to the hospital, they are significantly away from the work. So which will also lead to late presentation and the same pathway, increasing the cost. Another is lack of dedicated burn units outside capital. So most of the burn cases will have to be referred to Kathmandu, which will lead to late presentation, increased number of days, and again the same pathway leading to increased cost. So this is why the hospital like ours also go outside Kathmandu 2 to 3 times a year for surgical camps, but it is also a financial burden to the donors. In our case, Interpass Germany spends $18,616 more or less for one surgical camp. Also, lack of burn specialists outside capital, which means referral to capital, could be due to and could increase the cost because of transportation, loss of income, late presentation, and increased cost. For this, we are trying to focus mainly on the health professional training of all levels with the help of organization, government and non-government organizations, and Interburns have contributed massively in our country since 2011. Other hidden costs could be due to the psychological impact and untreated medical condition leading to burn, and also leading to not seeking of the burn care, which will lead to late presentation. Infections and complications also because of all the various reasons I mentioned in previous slides. And infections leads to increased number of days, increased number of medications, expensive dressing material, leading to the cost, increased cost in the treatment. Lack of rehabilitation services outside Kathmandu will have, the patients will need to seek for the private sectors and also maybe buy some equipments to take it back home because they are not able to come daily to rehabilitation, which can increase the cost of their treatment. Social support, when families do not have time and have to hire extra caregivers, it will also increase the cost of the treatment rather than the direct treatment. So the visible scars and disabilities in the young patients' psychological distress can lead to their lost opportunity for employment, which is a burden to them. So all in all, we can see that burn treatment can affect the entire family, community, and nation. And the nation, the government has to give the disability allowance also, which is also another financial burden to the government. And overhead cost items for the hospitals that are giving charity treatment to these burn patients are not even talked about and never reimbursed. And the lack of quality treatment can lead to readmissions and complications. So the cost of inpatient burn management in Nepal studies showed that there's a need of comprehensive burn strategy in Nepal and in LMIC. The resources have to be secured, and there should be increased government attention for this. For this, everybody should come hand in hand with multifaceted approach, access to healthcare, enhancing public health education, and financial support to these institutions should be supported. Thank you very much for your time and listening to me.
Thank you very much, Rojina, for your very interesting and kind presentation. France has a specific way of refunding burn patients after their acute care. And in this refunding, the lawyers have a great part to play, nonetheless, to demand it, but also they evaluate the cost. This is the reason why we asked Carine Haddad, who was certified in Paris 1 Panthéon-Sorbonne University, and has a special certificate in personal damage. She's been a lawyer for 14 years now, and she's associate in the NP Avocat Associé, which is specialized in the case of personal damage and especially burns. So she will explain you how a lawyer can unravel some of the hidden costs. And the cherry on the cake, she is a member of the French Society for Burns. Please launch the video from Carine.
Hello, everybody. I'm Carine Haddad, French lawyer. I work in Paris in a French law office specialized in the defense of personal injury claims. And today I will present the hidden cost of the child burn victim. First of all, I would like to present in few words the French system of compensation. In France, there is a lot of childbirth victims every year. Most of the time, they are victims of domestic or traffic accident. In most of cases, a compensation can be sought. Parents, especially when having caused the injury, are strongly involved in their children's treatment, as well as the fight for their rights to receive compensation. The compensation for the child has specific features regarding the date for assessing the compensation, and also the nature and the number of injuries giving rise to compensation. The date of consolidation, date de consolidation, a specific term in French, it is the date when the victim's condition is not supposed to progress anymore. This date will determine the date for assessing the compensation. From the day when the injury will no longer improve, the consolidation is declared and compensation can be sought. Usually, in case of severe burns, consolidation may only occur at the end of the child growth process. Only medical experts will state on this issue for each case. During all the active treatments period, and even after the consolidation date, the parents will face huge expenses, some of them not being refunded by social welfare. This is why today I will focus on some financial costs assumed by parents. First of all, we have thermal therapy. If the thermal therapy itself is refunded by social welfare, many connected expenses are not, such as transport and housing. Furthermore, housing near the thermal center is very expensive, and parents stay with the child all along the therapy, which takes about 2 weeks. We have also the psychological follow-up. Opposite to psychiatry, psychological follow-up is not refunded by Medicare. Even if not all burns victims are concerned by psychological follow-up, most of them will endure post-traumatic stress disorders, needing the response of a psychologist. After that, we have also the assistance of a third person. Some victims can benefit from specific help for a few hours of a third person, which help is covered by the state. Usually, this help is insufficient regarding the needs of burn child who needs permanent assistance. This assistance represents, for example, help for applying creams, performing the scarce massage, putting on and out the compressive garments, hand washing these garments, putting on and out the potential equipments, feeding, ensuring treatments take. And this kind of help is very, very expensive in France. For example, 1 hour of assistance is cost between 20 and 30 euros. And there is no distinction if this help is provided by parents or by professionals. After that, we have dermatological products. So moisturizing ointment, high-fat soaps, solar creams are needed all along life of a burn patient. They represent high cost. They are never covered by medical care, and even not by private insurance. Sorry. We have also corrective makeups that they are not refunded. However, burns victims need to hide visible signs of burns. For example, they use corrective makeups for face, hands, neck. also to hide the visible signs, it's usual now for victims to make tattoos, and also tattoos are not refunded in France, but patients regularly now use tattoos to hide their scares. We have also for hair solutions. Burn victims use wigs. Some wigs are refunded, but they are the synthetic ones used for cancer patients. They do not adapt the very sensitive and delicate burn scalp. Natural hair manufacturers' wigs are mandatory. However, they are not refunded, but by medical care, even they are very expensive, and also they should be changed every year. So it's a very important cost for parents. For example, one wig, very good quality, can cost around 2,000 euros, 3,000 euros. It's a very important cost that are necessary for victims of burns. After that, you have housing and vehicle adaptations. So ergotherapy assessment will identify the devices that could be proposed in order to enhance the quality of life. Housing adaptation to a potential disability may be needed. Bathing room, lift in a multi-floored house, adapting to a wheelchair. This can require either a move or profound works under the supervision of an architect. Both are very expensive. Also for vehicle adaptation, facing a wheelchaired child, parents can have to buy specific vehicles. You have also scholar support. Scholar support is usually available in both acute care and rehabilitation centers. However, this support remains frequently needing back home, either to stabilize the knowledge or even acquire it. These home supports are very, very expensive. So now the question is about the personal injury compensation amounts. Depends if there is a split liability or not. When the child has a right to the compensation, total or partial, all these costs can be refunded. Before the consolidation state, parents can ask for a partial funding, which will be part of the final compensation. The needs continuing after the consolidation, a lifelong compensation can be solicited. It is calculated depending on the cost of every needs and their frequencies. And to finish, it's important to talk about parents, because they have to figure out with the cost for their child, but they have also their own costs in relation with the injury of their child. In fact, in addition of these expenses, parents face the direct cost of the multiple moves their child needs, follow-up, physiotherapy, etc. They also endure reduced incomes, working days lost due to their presence by their child, if they do not lose their jobs. I will thank you for your attention, and it will be a pleasure for me to answer if you have any questions. Thank you.
Thank you very much, Carine. I'm pretty sure that some of us just learned some hidden costs, and the other had them seen reminded. Speaking of the cost, you should have in mind that the median income in France per month is 1,700 euros. So imagine what it is in Nepal and in other low and middle income countries. Now it's my pleasure to introduce Elisabeth Dadzie Yeboah, sorry. She's a senior clinical psychologist in the teaching hospital Korlebu in Ghana, which is, as you know, the capital, Accra, which is, as you know, the capital of Ghana. And we are hoping that she will have her PhD diploma pretty soon. Please, Elisabeth.
Hi, my name is Elizabeth Yeboah, and I'm presenting on the hidden cost of burns from the psychological standpoint. The psychological impact of burns can be profound, extending far beyond the physical scar, from the initial trauma to the long-term emotional and social challenges. Burn survivors face a complex journey of healing and recovery. And in burns treatment, we can divide the treatment into three: the resuscitative phase, the acute phase, and the rehabilitation phase. And all these things have psychological impact or psychological issues that burns patients go through. The acute phase has its own psychological challenges. The resuscitative stage has its own psychological challenges. And that of the rehabilitation phase, which is even a process, it's always ongoing. One psychological issue will stem up every day of their life as they integrate or as they move into the community. So they go through trauma, depression, anxiety, body image issue, leading to body dysmorphic, then negative appraisal of themselves, leading to low self-esteem and the rest. Then nobody prepares to be a burns patient. Nobody prepares to be burned. So it is sudden and often life-threatening nature of burns can leave deep psychological scars, triggering acute stress symptoms, leading to post-traumatic stress disorders, having flashbacks and overwhelming thoughts. And these thoughts can lead to depression because they feel sad about the issue, and the long-term and physical limitation of burns can lead to the feeling of despair, hopelessness, worthlessness, and sometimes they lose self-identity. Then burn survivor may struggle with anxiety about their appearance, the future medical procedure, the reintegrating into the society or into the public space because of the fear of unknown, and this affects their daily life and emotional challenges, adjusting to new normal, coping with this chronic pain. And if you are in the ICU, the beeping of machines and the rest, navigating the evolving self can be ongoing battle that burns patients go through it. And burn survivors face discrimination, stigmatization, difficulty in reintegrating another thing, and because of that, they isolate themselves from the community, from the family members, affecting their intimate relationship, affecting the family dynamics and the rest. Because when somebody goes through burns, it is very expensive, and sometimes it drains it creates financial problem, or it drains the family members financially, sometimes because of the financial burden that it brings on the family members. They withdraw and they don't visit, and because of that, the individual feel alone and they go through a lot of issues, psychological trauma, and adjustment difficulty that persists more than a year after discharge, usually involve perception of diminished quality of life and lower self-esteem. Some studies suggest that burns disfigurement in general lead to decreased self-esteem in women and social withdrawal in men. Then bringing in the changing phase, which is a successful program to enhance self-esteem. So Ben's patients some go through the changing phase program where we educate them on some of the things that they need to wear, how they need to look, the kind of wig that will be good for them, and the kind of dress that they should take. And many patients face a lengthy period of outpatient recovery before being able to return to work. So some patients go through vocational challenges. In recent study of patient hospitalization for burns injury, it's about 66% return to work within 6 months of their burns injury, and 81% had returned by 1 year. As expected, patients who sustain larger burns take a longer time to return to work, and half of these patients require some change in job status. And because of that, there sometimes their vocation is challenged. They have reduced ability, and sometimes changing job is not easy because of the way they look and because of their appearance. It affects them so much. There are strategies for psychological healing. We look out for mindfulness, and in mindfulness we let them meditate upon the issue, meditate, find a safe place, do yoga to come to terms of how they are now in order to reduce the stress and the anxiety that they go through. Then they have the expressive therapy, which is about expressing themselves in their artistic nature. They go through arts, they do music to express themselves and provide outlets for their emotion, process their emotion, how they are feeling, and the rest. Then social support. We advise family members, we do family therapy for family members to understand. Sometimes you see a burns patient and their psychological issue is stemming from financial problem because of the financial burden, family members have stopped visiting, and because of that they cannot afford their change of dressing, they cannot afford some hospital procedure. And as a psychologist, in order to solve these psychological issue, we tackle it from the root. So we go out soliciting for funds just to relieve them of these financial burdens, and we also advise or we talk to family members to come to their aid often so that they will not be left alone, or there will not be a feeling of they being left alone and the rest. So we search out for social group support, we look out for peer counseling by burn survivors, bringing them together for them to share their experience, for them to network, and for them to talk to each other. Sometimes when as a therapist you are talking, they have a feeling that you've not been there, so you don't know. But when their other colleagues or their peers are talking about their experience, they tend to share similar view and they pick it from there. So a burn injury and its subsequent treatment are among the most painful experience a person can encounter. The emotional needs of a patient with burns have long been overshadowed by the emphasis on survival. So patients undergo through various stages of adjustment and facing emotional challenges parallel the stage of physical recovery. Adjustment to burn injuries seem involve a complex interplay between the patient's characteristics before the injury, moderating the environmental factors and the nature of injury, and ensuring the medical care. So for them, while the physical scar and burn may heal, the psychological impacts or the psychological challenge linger for years. It becomes a process. Every day something comes up, and because of that, we need to provide a comprehensive, compassionate care that address the emotional, social, and mental needs of these burn survivors so that they will recover and recover fully from their burns. Thank you.
Thank you, Elizabeth, for this thorough presentation of the psychological aspect of burn, which is probably the most undercovered sequelae of burns. Clearly, with this presentation, you deserve a PhD. Now to Richard Nnabuko, who is burn surgeon, plastic and reconstructive surgeon working in Nigeria. He has been the representative of the SBI in Nigeria. He has been the president of the Nigerian Society for Burns and of the Pan-African Society for Burns, and he is a member of Interburns board. That's to say that Richard Nnabuko is someone. Please, Richard.
Thank you, Ronan. Good morning, good afternoon, good evening. I wouldn't say good night to those of you who are in the night, so you don't go to bed yet. Thanks once again to all the organizers of this wonderful meeting. Today, I just want us to look briefly at burn mass casualty incidents in Africa, hidden costs. Burn mass casualty incidents are a significant public health problem in sub-Saharan Africa, resulting in devastating consequences for individuals, for families, and for communities. According to the World Health Organization, nearly 3/4 of all fire-related deaths occur in the LMICs, with sub-Saharan Africa accounting for a large proportion of these deaths. Rojina had already talked a bit about the incidents, and so we won't spend time on that. If you have a look at the slide, the slides on the left of your screen show fire detected from NASA's Fire Information for Resource Management System in 2005. And that is from the first slide on the top left there was in January, and it goes on regular slides. The bottom right there is in August. And you'll notice that there is a persistent fire belt in West Africa that seems to progress southwards to East Africa and down to South Africa. And one from this will say, at any time, something is burning somewhere in Africa. Now, if you look at that map in 2005 and consider this other map, the big one on the right, taken in January 31, 2022, you'll discover one thing, that there's not been much change. And of course, these maps are done regularly, like every week, every day or whatever, every week, every month, every month of the year for the 12 months every year. So you have a world map, but this is just for Africa. So you discover that Africa always has something burning somewhere. Now, one will ask, what are the causes of these fires? Commonly, we say what we've noticed is that they are related to petroleum industry. And in my country, for example, we talk of pipeline vandalization, where people break pipelines that carry petroleum products to scoop or to steal products from the pipelines. You can see the top left picture. That runs even through a community where people live close by to the pipes. And in remote areas where these pipes run, people fracture the pipes to steal the products. And the entire environment is saturated by very volatile fumes. And before you know it, there's fire. Overturned tanker phenomenon is common now, virtually in every part of Africa. And a curse, which we are seeing in Nigeria, is the development of illegal refineries, adulterated kerosene and liquefied natural gas, bushfires, and of course, arson that comes from criminal activities. So if you look at this chart from different 2014 down to 2023, you'll notice that this overturned tanker phenomenon is common. It's in Sudan, in Mozambique, in Kenya, in Somalia, in Tanzania, in West Cameroon, in the Gambia, in Sierra Leone. And each incident is associated with very large mortality. Now, you will hear this number dead, several others injured. Nobody knows exactly the number of those who get injured. I know many of these people get involved in these criminal activities, and when they survive, they don't want to be seen by authority or by people to be people who have been involved in that criminal activity. So we don't really know the numbers of people who survive these incidents. Mass casualty incidents in our environment, it's very peculiar because there is a poor allocation to health in many national budgets, and specialized and intensive care is often a challenge. There are a large number of mortalities, unknown number of survivors. Incidents often happen in difficult locations. Manpower deficiencies lead to overwhelming of either firefighting provisions or care. Now, why is it that these things happen repeatedly? And I have said it happens because of what I call the pig triad. Well, not this pig, this other pig. It's due to poverty, ignorance, and greed. People are poor, and so they want to make support themselves by any form of business. Ignorance, people don't know. They don't learn, they have not learned, maybe they've not been taught on the dangers of storing or dealing with these volatile petroleum products. And one will wonder, why should it repeatedly occur in an environment? And that's where greed comes in. So managing these fires means that governments and humanitarian organizations must massively educate the populace towards prevention. They must improve safety regulations, establish management plans, prevent disasters, and provide adequate support. But all of this costs money. Who bears the cost of this? Rojina has talked about the born care drivers, resuscitation, dressings, analgesics, theater, ICU. Now, this is for patients who get to hospital, who are admitted in hospital. When you take the total cost, which will be a summation of all of this, plus the non-born care costs, and you multiply it by huge numbers that may survive, then you begin to have a picture of enormous costs that are involved. A number of these costs, we say they are hidden. How can you quantify loss of productivity, reduction in quality of life, the economic and environmental burden? Many of these communities get so scorched by fire, disasters, that nothing will grow in such communities anymore. You talk of the psychological problems, which we have tried to hear, the social stigma, which can have long-term implications for families and communities. All of these are associated with huge costs. And when you begin to assess this, the question one asks is, who pays for these costs? And because these costs on the long term are huge, many governments in our region don't invest so much in burn care, which is very unfortunate. Well, part of talking about this is to give each one of us something to think about. Is there something each of us can do? And I'm particularly pleased with this Global World Burn Day, because this month will mark the 12th anniversary of the National Burn Week that we started in Nigeria many years ago. And we've tried to address some of it, but as a society, there's a limit to what you can do. To be involved in most of this requires funds, requires resources. And where do this come from? So, ladies and gentlemen, we do have a problem in the lower middle income countries. We have a problem globally, and I think it's time for us to put heads together and see what the solution will be. Thank you very much for listening.
Thank you so much, Richard. Clearly, the problem of the fuel scooping after tanker overtuning is a very, very, very big problem in the low and middle incomes countries, especially low incomes. But how can you prevent someone to scoop some fuel if he doesn't have anything to eat? Last but not least, Eileyn Chua, who is a burn survivor after a gas explosion in 2016 in Malaysia. She is a burn survivor, yes, but also lawyer, writer, speaker. She has a very large curriculum vitae, and she will explain us what does really cost a burn. Please, Eileyn.
Hello everyone, my name is Eileyn and I'm from Malaysia. Today I'll be sharing my survivor story on how much does it really cost for a burn survivor. A little bit of a background story. On the 15th of April 2016, I smelled gas from my bedroom. I went downstairs to the kitchen. I was trying to make sure that the knob of the stove was properly shut when suddenly there was a spark. As a result of the spark, there was a gas explosion. I was flung backwards. I could see things melting before my very eyes. Plastic melted like wax. Plates and bowls smashing themselves to the ground. Cupboards collapsed. It was so hot that my clothes were burned to ashes. This is a newspaper clipping of the incident. On the left-hand side, that is the kitchen where it all happened. And on the right-hand side, that is the front of the house. Even the fence at the front of the house collapsed. They brought me to General Hospital Penang that day. And the doctors didn't know whether I would live or die, as I had 80% burns all over my body. And during that time, the doctors did not have any record of anyone surviving 80% burns at that hospital. They even informed my family members that they should prepare for the worst. This is a picture of me in the ICU. I was in a coma for 2.5 months, in the ICU for nearly 4 months. And I was only officially discharged from the hospital after a year, 3 months, and 20 days. At the ICU, I had blood sepsis, which I nearly died from. And at the burn ward, I had MRSA up to 4 times. So today will be my own personal sharing about how much does it really cost for a burn survivor. The first thing that I would like to share is on the burn incident itself. For myself, for a few years after the burn incident, whenever I hear someone drop the plate or fireworks or sudden loud banging sound, I would get triggered. I had this sense of panic. And once my sister and myself, we were at the petrol station and someone spilled petrol on the floor. And that caused me anxiety. Fortunately for myself, I had overcome most of this trauma. The second thing that I would like to share is on the medical treatment and dressing change. The most painful thing any burn survivors will tell you is during the dressing change. Even a grown man will scream and cry, depending on the type of dressing that they use. For myself, my most painful dressing change was when they soaked povidone iodine in a gauze and they changed the dressing 3 to 4 times a day. That was the most painful thing that I have ever come across. And I've also known of some patients who actually ran away from the hospital because the pain was unbearable. The third thing that I would like to share is on the slow healing process and breakdown of wounds. Burnt skin takes a long time to heal. And sometimes it looks like it's about to heal and it just breaks down again. For example, the scalp on my head, it was the donor area and it broke down a few times. And not only that, it took around 2.5 years just to heal the wound area. So during this time, many burn survivors will feel very frustrated because the doctors can't tell them whether their wounds will heal nicely. Sometimes it doesn't heal until a few years later. Many burn survivors have to go numerous surgeries. For myself, I'm pretty lucky. For 80% burn, I only had 9 surgeries. I know of some people who had been burned since young who had to go up to 100 surgeries just to correct their contractures. And this is indeed traumatizing for many burn survivors to go for surgeries. Many burn survivors face loss of independence. For myself, when I came out from my coma after 2.5 months, I had muscle atrophy. My muscle just wasted away. And I could hardly even speak. I had to depend on the nurses for everything. And it was really a difficult time for me because being dependent on others was not something that I was pleased at. And some may even lose their range of movement because of contractures. The next thing I'd like to share is on the loss of time. Now, many of us burn survivors, we feel that we have lost a few years because of the healing stage. Most of us will feel tired, will feel in pain, will feel angry. And as what Rojina has just mentioned just now, many may even lose their job, and it is really a dilemma for them because it is a financial burden. And what I would like to say is that many breadwinners may feel the pinch because of this incident. Some may even lose their relationship because their spouse may not be able to accept them anymore. As for mental health issues, I believe Elizabeth has shared about this just now. I would like to just add on a few things. I'll just say that for a burn survivor, it is a domino effect. First, from the time of the burn to the pain thereafter, the prolonged hospital stay, and the slow healing process. And the list just goes on. And sometimes it goes on for a few years. And it is very demoralizing for many burn survivors. With regards to the issue of ignorance and social stigma, I would like to say that I face people who have asked me about my skin. And most general public do not know that once skin is burned, the skin will not go back to normal. I guess perhaps some people are misinformed by drama series whereby a disfigured person would suddenly become beautiful again after plastic surgeries. And perhaps they only get information from movies about how a burn survivor is supposed to be like. However, most movies will portray a burn survivor as being evil or insane. For example, Phantom of the Opera, or Freddy Krueger, or even Deadpool. I have the permission of my friend to share about her experience. One day, she called a driver through a popular share riding app. So when the driver came, he looked at her and said, "I can't accept you please call another driver. She was really devastated because she felt that the driver couldn't accept her as she is. Just like anyone else, a burn survivor wants to be accepted by society. Burn survivor needs the support of those around us, from our family, from friends, from society. And for myself, I'm lucky that I have the support of those around me. And during my stay at the burn ward, I was lucky that one burn survivor came and actually gave me some good advices. And I found Phoenix Society website, and I joined their peer support chat and communicated with other burn survivors as well. I believe Amy is here today. So Amy, thank you for the support. And in future, I hope that I could build a burn support association or society in Malaysia too. So how much does it really cost for a burn survivor? It not only costs money, it also affects physically, mentally, and emotionally. And as what Richard says, it is impossible to quantify on how much it really costs. Back to you, Ronan.
Sorry, Eileyn. I was listening so deeply to you that I let a few seconds pass through. You spoke on behalf of so many people that no one just want to listen, if even they accept to hear them. It was a great, great, great testimony. Now we'll change the language from French Pidgin to English, and I give the microphone to Lucy Kynge.
Hello, everybody. It's great to see you all here today. I'll try and speak coherent English. My name is Lucy Kynge, and I'm with Interburns, which is the International Network of Training, Education, and Research in Burns. Thank you so much to all our panelists for helping us understand some of the hidden costs today: financial, psychological, legal, mass casualty, and most importantly, survivorship. This week is all about coming together as a global community to share and to raise the profile of burns and to do more. It's been amazing. There have been 26 countries here today with us, and huge diversity of countries, but there is a commonality around this issue. And I think it's one of the things of Burns Week, that we're all coming together to understand and do more about this issue. We do have a couple of minutes for questions. If anybody would like to type a question in the chat for the panelists, there's just one here. Question for you, Eileyn. How were you integrated into society? How easy was it, or how difficult was it for you to integrate in after your injury? Thanks for that question.
I would say after the burn, after a few years, I was just concentrating on my pain. I was just concentrating on my healing. But after I went back to work, that was when I was much better. I began to feel like I am contributing to society. And when I share my story, I find that people could relate to it, even those who are not burned, because I want to be able to share to others that a burn survivor's life is not the end after the burn. We can face challenges or difficulties, and we need to have hope. So that is what my message is to all the burn survivors. Don't give up hope. Thank you.
Thank you so much. Just a quick follow-up question on that. Did you feel very isolated? How difficult was it for you? You said you felt much better when you got back to work, but it must have been very difficult actually getting back to work. Was that very challenging?
It was challenging, but for myself, I felt that after I have accepted the fact that the incident had happened to me, and that I am actually a reborn person. In other words, the burn incident does not stop me from progressing further. To be truthful, I feel that I'm doing more now in my life compared to the time before the burn. I feel that I am actually doing more activities. I am doing more things. And yes, indeed, it was difficult initial part when I couldn't walk, when I was not mobile. But I had the time to reflect on my life. And that was very important because when I reflected on my life, I realized what I was unhappy about and what I wanted to improve on. And I truly feel grateful because I've been given a second chance in life, and not everyone has been given a second chance in life. And because of that, thankfulness that I felt, the gratefulness that I felt, and the support that I received from others, from other burn survivors and the people around me, I could progress. So I feel that it is very important that people who are family members of burn survivors to support a burn survivor. Yes, during the initial stages, it is really difficult. It is really difficult. But once that burn survivor is able to accept the reality of the situation and to let go of the past, that person can do more because this is a second chance in life for them.
Thank you so much, Eileyn. Yeah, totally. I don't think we can follow that with much else, actually. It's hugely inspirational. And again, thank you to everybody, all the panelists today and to the participants. That concludes day 2 of World Burns Week. And we really hope that you can join us all tomorrow for day 3, which is on the common responsibility, using the same Zoom link at the same time. And just wishing you all the best from all around the world. And thank you so much for joining us today. Thank you.